I'm going to talk about using technologies to promote mental health and well-being, and I want to focus particularly at how we can harness the potential of technologies for mental health promotion and prevention. So I'm going to kind of focus particularly on that. Say a little bit about the research findings from the Bridging the Digital Disconnect project, which with my colleague Dr. Alicia Clark and with Derek from Inspire Ireland, we've been engaged with over the last 2 years, and the report will be launched with Alicia telling you more about it later this morning. And this work is being carried out in collaboration with the Young and Well Cooperative Research Centre from Australia, which is a huge initiative, and Michelle Blanchard is here on the second row and told us quite a lot about the extent of that international effort being driven from Australia yesterday. Now, I think it's clear from everything that was said, and we had a very good discussion last night, that the internet and social media, they are a part of all our lives. They've transformed our lives. And in the international literature, much of it coming out of Australia, in fact, I mean, clearly these are very powerful communication tools. And they've also been described as a setting, a virtual setting, for promoting mental health and well-being. Looking at it as a communication tool, clearly it's a massive source of information. There's a vast amount of information. The issue is more, what do you do with it all? It's also a source of support, but also enabling connectedness, and that feeds into our fundamental need as humans to communicate, to belong, and using technologies as a tool to do that in a way perhaps with a speed and an immediacy that has not happened before. Also, in terms of creating personal public profiles, be it through our work profiles, our social profiles, and this is quite interesting in terms of how we present ourselves publicly, and the issue of self-identity formation, particularly for young people, and the impact of that. In terms of seeing it as a setting, as I said, in terms of establishing and maintaining relationships, I mean, I'm thinking in terms of my own work life, it's been completely changed. The way in which, we have a whole suite of colleagues internationally that we can communicate with so rapidly. And even colleagues that are sit down the corridor, you're communicating with them without seeing them. So it's quite extensive. And of course, social relationships. We've seen that through the social network sites. But in terms of the mental health promotion and prevention area, clearly all of this says that we should look at this as also in terms of how we deliver support, interventions and strategies that can promote good mental health and prevent health problems from arising. So in my talk, I want to look at how we can build a greater understanding of mental health and its importance for health and well-being in a more positive way at a public level. How the internet and social media can be used to empower and mobilize communities and individuals to initiate their own actions around promoting their mental health. And I want to say a little bit about maybe engaging with a broader concept of mental health literacy. What does it mean to be mental health literate? Yeah, that's right. And what does that mean for individuals? What does it mean for us as a society? I think that's worth thinking about. What's a mentally healthy literate society look like? And also the way in which technologies can be used as an advocacy tool for policies that will create the conditions that promote and protect population mental health, be it in terms of reorienting services, be it in terms of getting mental health promotion and prevention on the health policy agenda and in other sectors. So that this is, I think, quite an important development. So I want to say a little bit about mental health promotion, just to kind of start with, in that this is really critical for population health and well-being. And I think the WHO phrase, "there is no health without mental health," captures that. It's of concern for everybody. We have quite now a growing international evidence and a knowledge base about interventions that will promote good mental health. And we have a lot of knowledge about policies that have been implemented in various countries around the world in terms of making that work and putting it into action. And we know that when you promote mental health, that it has a good return and investment in terms of both social, it's good for social well-being, it's good for health overall, and also there's an economic return on that, so it's good for society. The issue is, if we know that there are effective approaches, how do we make that more widely available? How do we make sure that it gets to everybody who could benefit from it? And that's the issue of scaling that up, making it more widely available. And of course, this is where technologies can really assist with that. And the final point there is, it's quite clear. If we look at the factors that influence mental health, they are where we live our lives. So it's about unlocking the potential in other sectors of society and among local communities and families to support good mental health and to work towards prevention. This definition here of mental health will show you that mental health is a very positive concept, in fact. It's a state of emotional and social well-being in which individuals realize their own abilities, can manage the normal stresses of life, can work effectively, and is able to play a role in one's community. And if you look at defining mental health in that way, it's much more than the absence of mental ill health. And also, it's clear that technologies can play a part in that. So this is where we're positioning it. There's been much more interest in recent years in looking at a positive mental health and looking at understanding what does that mean. And I'm talking here about the work of Corey Keyes and Felicia Huppert in Cambridge, and of course Carol Riff and colleagues in positive psychology. And that good mental health is about a sense of subjective well-being and life satisfaction, but it's also the ability to function positively, to be engaged, to have a fulfilling life and a sense of meaning in that and a sense of social well-being. So look, what's not to be interested in that? This is what we're all about. And so that's the notion. I think that concept of flourishing kind of captured that. Like if you look, we all want to thrive, we all want to flourish. There'll be hurdles along the way, but that's the direction we all want to go in. So essentially when we talk about mental health promotion, it's about engaging in that. And it's focusing on positive mental health and well-being, looking at how we can build psychological strengths, building up life competencies that we all need, and access to resources that will make that possible. When we talk about prevention, we're clearly looking at preventing mental health problems and mental disorders from arising, or reducing their duration and their seriousness. So we're talking here about anxiety and depression, common mental health problems that we all experience to various levels, and reducing the kind of risk that may be associated with that, be that suicide, be that clinical disorders that can be quite disabling, and the associated risk behaviours. So when we look at it, what we're saying here is that most of our services really are concentrated at this end. They are concentrated at identifying caseness, clinical disorders, looking at appropriate treatment and aftercare. And of course, yes, we need that. But also we need to look at what can be done before it gets to that level. What kind of prevention strategies can be put in place that will enable us all to protect our mental health. And of course here, the vast majority here of how we can promote resilience, enabling us to enjoy life, but also to survive pain, because that's part of it. And very importantly here, I think, looking at supportive environments. Are the environments in which we live supportive of good mental health, or are they damaging? And so really, and people move in and out of these territory, but the vast majority of the time, most of us are around here. So we actually do need to pay much more attention to how we promote good mental health and look at early intervention and prevention, as well as treatment. I'm not denying the importance of that, but I'm just saying in terms of a population perspective, we need to include that. So if we look at a model of mental health promotion, it's about strengthening individuals, looking at the emotional and cognitive resources that we need for everyday life and life skills. It's about strengthening social networks, that sense of social belonging. At a community level, about civic engagement, and at a societal level, the structural factors that make all of that viable really in terms of good access to good education, to employment, to housing, to welfare, and our sense of citizenship. All of these levels are really important for population mental health, and we need to kind of address all of those. And as I'm going through that, you can see that technologies play a part at each of these levels. So we say that mental health is created in the settings where people live their lives. It's not in the clinics, it's not in the hospitals, it's where we are, in our homes, in our communities, and in our schools and workplaces. So here we want to look at how technologies can enhance our access to resources and opportunities, be that supportive relationships, life skills, education, and access to services. So here, clearly, internet, new media, social network sites have a big part to play and already play a part, and it's about harnessing it and harnessing its potential. When we look at the international literature, there's quite a lot there in terms of how technologies can support, I think, at the individual level, in terms of developing life skills and social competencies, all of these areas, problem solving, relationship skills, and of course a massive amount in terms of enabling that sense of connectedness between our various settings. And there we have seen a growth in terms of the number of online interventions that have been tried and tested and are available. But to harness the potential of online technologies, I think we need to look at two aspects at least. We need to look at both the mental health literacy component and the digital literacy component. We need to look at both of those. So I'm just going to start maybe a little bit about the mental health literacy and what do we mean by that. And clearly, in terms of enhancing mental health literacy at a population level, we need very effective communication strategies. And here I would argue that mental health literacy is actually broader than knowledge and beliefs about mental disorders. Sometimes mental health literacy is put forward as being able to identify signs and symptoms. And yes, it is about that, but it's also about more than that. It's also very much a resource for empowering people around understanding their own mental health, what they can do to promote that, as well as prevention and as well as treatment. So we have seen in the general health literacy, there's a lot of focus on that now in terms of broadening our understanding of what does health literacy mean. It's more than just the functional literacy of being able to read and understand prescriptions. It's much bigger than that. And we know that health literacy, really, people with limited or low health literacy have poorer health outcomes, less likely to engage with services, and all of the consequences from that. And of course, this is a particularly important issue, as was mentioned earlier by the Minister and others, in terms of mental health, because no matter, I talk about mental health in a positive way, but there's still quite a lot of stigma. So how do you break that down so that people can engage with mental health in a much more positive way? And stigma does mean that people, have a fear of being labelled, of being discriminated, and also policymakers are less likely to make it a priority if it's not a priority issue for the public. So looking at these recent definitions of health literacy, here we can apply this as mental health as part of health. It's much more than just about accessing information. It's about actually what you do with that, how you appraise that, how you critically appraise it, and then whether or not you can apply it in the context of your everyday life, not only in relation to whether or not you need treatment, but in relation to prevention and in relation to health promotion. And that's quite important. So it's across, how do you look after your own health? How do you understand the factors that impact on that? So this is like Don Nutbeam's concept of critical health literacy. And I think this is very similar in terms of when you access information on the web. There's a huge amount of information. How do you cut through that? How do you critically appraise it? How do you know which bits to kind of say, well, yes, this is useful or this is credible? And then also, how am I going to use it? How am I going to make this relevant to my life in the context I live? So this is where mental health literacy and digital literacy is about how do you appraise all that tsunami of information that you can access. There was an interesting publication from the WHO in June on health literacy, and I think they were looking at health literacy and saying it's more than just an individual ability. It's also about organizations and settings being, health literacy friendly, so that they will be knowledgeable of the impact of what they do on health. So we can look at this in terms of mental health. What would that look like? I mean, we have to look at our understandings of mental health is more than just an individual phenomenon. It's how mental health is embedded in society and in our culture. Right? How it's embedded in our health systems, our education systems. So this I think is really interesting to look at how those settings and systems could become more mental health literate, so that they would have a greater awareness of that. Our schools, our workplaces, our communities, and our health services, because very often mental health is not to the fore in terms of our interaction with our health services. So I think that there is huge potential here in terms of looking at online communication strategies that can be tailored for different audiences using appropriate language and media to build up that larger and more comprehensive understanding of good mental health and what it is and how it comes about. And I think also in terms of reorienting our health services, in making these strategies and resources available to a much wider population, be that through our treatment services, be it through primary care. And also in terms of advocacy, in terms of working with other sectors that can support good mental health for children, for parents, for families, across all the services that we interact with every day, because that's really critical. So this is where I suppose, coming on to, I suppose, the origins of the study that we started with Derek and colleagues in Inspire Ireland and linked to the Young and Well Cooperative Research Centre in Melbourne, that my colleague here, Alicia Clark, we engaged in a 3-year programme of research to look at this issue of how using technology to support young people's mental health, and being aware of the fact that while young people actually have high levels of digital literacy, a lot of the adults dealing with them may not. And also that there's a need, we already had a confession this morning, and also that there is a need to look at mental health literacy across both of those, and how can we bring that together. So we started by saying, let's look at parents and teachers, the adults and youth workers, social workers, health and mental health professionals who work with young people, and let's look at their knowledge and understanding of technology and how it can be used to support young people's mental health. And the idea here was to work with Inspire Ireland around developing online resources that would enable us to bridge that divide, and then to evaluate the effectiveness of that. So we set up a 3-year programme of research with funding from the CRC in Australia. We reviewed the international literature. Well, what's out there? What can we see from the research that's working and making a difference? Let's talk to parents and find out what their needs are. Then we said, let's go and talk to the health education and the various mental health professionals. What would be useful to support them in their work? And then take it all back and go to young people and say, well, what do you make of all this? You know, this is these youth participatory study. Because if you bridge the divide, you have to come at it from both ends. So you need that perspective. And so we're in the middle of sort of various parts of this work has been done, and we're in the middle of sort of writing up results and producing the reports. Just to say a few words about the review of the literature that Alicia and Tuuli Kuzminen and myself were involved in. A lot of these studies are coming from Australia and the US. They're the 2 main countries. But it's quite interesting that when we reviewed a lot of the articles that were out there, but when you boil it down, to the really robust research papers, there were about 30 studies of 21 web-based interventions. And it's interesting, 2/3 of them have been published since 2009, so there's a huge growth in this quite recently. And the evidence is moderate to strong evidence that yes, the internet can be used as an effective medium for the delivery of a range of both mental health promotion and prevention intervention, so that there's good, strong evidence out there. Be it in terms of giving information, more complex interactive programs like online gaming, mobile phone interventions, structured online modules, the use of blogging and online support. And also a number of these are kind of electronic versions of face-to-face programs as well. So there's a vast range of interventions that are out there that have been researched. Like one which I think there's been a lot of, there was this discussion last night, was Mood Gym as an example of one of these, which would be a cognitive behaviour therapy intervention available online. And in the UK, Beating the Blues would be something similar to that. But it takes young people through a structured approach online, and again, there's been quite a lot of quite strong research done in relation to the impact of that. So we can see from these studies that these mental health promotion interventions, for example, that they can increase people's mental health literacy, reduce stigma. Now, we looked at young people, particularly the research for those under 25, increase support-seeking behaviour, managing stress, and look, increasing resilience, positive thinking and problem solving. So this is quite important that these interventions are very effective in that way. Likewise, in relation to the prevention interventions, Here, particularly, most of them concentrate on depression and anxiety, and especially from computerized cognitive behavior therapy approaches. Again, the evidence is quite strong. Blogging in terms of improving self-esteem, and again, evidence emerging regarding online group support, leading to improved well-being. So it's very promising, the potential of all of these. None of the studies reported adverse effects, but I think it is worth highlighting that many of the studies did report a high dropout rate, and that is of concern, and particularly that the dropout rate was higher for those who were at higher risk. So that is concern. So how can we maintain good adherence and keeping those who may be at higher risk engaged? And again, participant support, be it through online or face-to-face, is important in doing that. So we need that input there, and again, more tailored kind of approaches. These interventions have been implemented across a number of settings. We do see that there's a bit of a gender imbalance here, that there's predominantly female participants. So they're more likely than males to engage in this. And also, many of the studies are with students who are in school or in university. So we need to just expand this out to kind of larger populations to see, does it work with kind of the more hard-to-reach groups and the groups who may be more vulnerable. So there's a potential here to reach a much wider range of population groups who wouldn't normally come through to request services. It has a potential to be a very cost-effective approach at a population level to really make it widely available. We do need to address issues of digital literacy and digital disconnect between younger and older populations. I think it's very important that there are kind of critical media literacy skills, that there is a critical approach to what you find on the web and being able to look and see, well, what is the accuracy of this information, is it credible, etc. And of course, online safety is incredibly important, and so that the technologies can be used effectively. So just to finish, I'm just going to say just a little bit about some of the early findings, because Alicia will talk more later this morning. The parents' views on using technologies to promote youth mental health, we had about 350 parents nationally involved in that. And the needs assessment survey with the other stakeholders, we have about 900 participants. And we went to the national professional bodies to ask the health professionals to participate. So here we would look at SPHE teachers, guidance counsellors, youth workers, social workers, health promotion officers, suicide resource officers, GPs, psychologists and psychiatrists. So we went across the board here in terms of getting those views. I won't say about the parents because Alicia will tell you more. That report is being launched today. Just very, very briefly in terms of the findings from the other stakeholder groups, I think that it's clear to all of them, look, the technologies are hugely important in the lives of young people. And basically, as providers, they need to use the medium that young people are using so that they really, have to come to grips with this. They also recognize that there is a technology gap between how they use media and how young people use it, and that gap has to be bridged. So they're very clear, and they're saying, yes, we need more confidence around using this. We need to know how to use it effectively. There is a kind of supportive reaction to the promotion of positive mental health, and for looking at online resources for working with young people. They tell us they would use these because there is a need for it and a demand, particularly around guidelines, directories, self-help material that they could recommend to young people they're working with, and also parents' resources, because if you're working with young people, you need to work with families. And so the professionals are saying, yes, we need this, and we would use them. They are concerned about online safety, and saying we need to know that we have information we can trust, that the site is reliable, and the confidentiality. So cyber safety and online safety is important, but it can be addressed. And many of the stakeholders were saying to us that, look, a combination of online and face-to-face support is what they would opt for. And we heard a lot of that discussed last night as well. So just to conclude then, just to say, we will be writing up the findings from that large needs assessment, and that should be ready after Christmas. The opportunities are huge, I think. we do need to make sure that we can create trustworthy online and social media channels, and I think this is a big issue, particularly for the adults involved and the professionals involved. And parents, online safety is a big concern, how content can be moderated and monitored. Now, the young people, when we talk to them, they think parents are completely paranoid about this, and and that they're just concerned about online safety and don't see any of the benefits. So, I mean, there's a useful dialogue to be had there between parents, young people, and indeed our health professionals. The capacity to tailor channels to different audiences, of course, is huge. And that means there's generally in health communication a shift from this get the message, send it down universally. It's much more of a more citizen-centered approach now, where you engage in social dialogue with different population groups and build up trust around it. So this is where I think the services who are going to engage with online need to do that. Start that social dialogue and build it up. And also I would like to say that I think that there is potential in online technologies to move beyond the focus on individuals only. I think we could look at strengthening social capital and using technologies in a much more structured way around that, in terms of maintaining social networks for different young people in different population groups as well. Strengthening active citizenship, strengthening civil society and how it can be used for the promotion of good mental health and well-being, and generally creating supportive environments. And I think that using the technology as a tool for advocacy and mobilizing change, that's vast. We've seen that in the political arena. Let's see it in terms of advocacy for mental health and advocacy for mental health promotion. So I'm just going to finish here and basically say I think we have a very powerful medium. We need to harness it, and we need to harness it for the good in terms of promoting a mentally healthy society and engaging a wider public engagement in a more positive way around mental health. Because, how social values and public policies impact in our mental health, we need to be much more aware of that, and so that we can advocate more effectively for mental health promotion and prevention to be put on the policy agenda, and critical digital literacy skills to be sort of delivered. Okay, thank you very much indeed.